Man, do you hear me?
Yes, can we start?
Yes, there are two questions. Is it okay for now? Just two questions?
Yes.
Okay, ליאת? ליאת? זה הזמן שלך עכשיו? לא, זה הזמן שלך לשאול. תסגרי. ליאת, כן. תסגרי. צריכה לבוא לפה כדי לשאול אותה. זהו, כן, שלי, חזרת, תשמע. Hello, Dr. Meng.
Yes.
I wanted to ask, please, about the temperature that you spoke about in the beginning, that we need to get to between 40 to 43 degrees. And how can we know that we reached this degrees? And again, please, why this is the most best degrees to treat?
Why is 43 degrees Celsius the most effective temperature?
Yes, and how do we know that we get to this temperature?
I mean, okay, so for the hospitals, for the hospital where they practice hypothermia, they insert temperature sensor into the body. And for example, when they have the temperature sensor inserted into the body parts, when they perform the hypothermia, they could actually monitor the temperature quite accurately. For us, if we are using our Onetsu, we cannot, unfortunately, we cannot monitor that. At one time, I was experimenting also using actually, because the temperature can be monitored also at the anus. Inserted the temperature sensor into the anus if we are actually treating prostate or the ovarian or at the ovarian cancer, we can, where the treatment is performed over there. I was actually using an external temperature, but inserted into the anus and then with the sensor sent by the Bluetooth. The device is inserted into the anus, okay, and then the temperature is monitored through the mobile phone, through the Bluetooth technology. You can do that, but again, very, very troublesome. If you want to do that, you can experiment on that. There are applications for that as well. Yeah, but for us using our own, home hypothermia device such as the Onetsu, we can only make use of the surface temperature to estimate what is the temperature underneath the skin. Yeah, so I would say we can monitor the external temperature by using a contactless thermometer. Okay, you know those thermometer where you can actually get it close to your body part and then you just monitor it. So that will be the closest estimate. Yeah, so that is my approach. So far, I have not found a proper method, effective method to measure the internal temperature. Yes.
Another question? Meng, another question?
Yes.
You said that lower doses of radiation in the combination of the hypothermia and the radiation, but you showed that 2GY is less effective than 4GYs.
Yes.
So it's more radiation, no?
Yes, of course. 4GY is a higher dosage as compared to the 2GY. But basically, this research actually what have informed us is actually that even at a low dosage of 2 GY, the effectiveness can still be very good. For example, in the case of the apoptosis over here, it is still 1.85 as compared to radiotherapy without hyperthemia. So what almost doubling the effectiveness. Okay, of course, with the 4 GY, in this particular case, it is more than double in both factors, the DNA damage as well as the apoptosis rate here. So I think the purpose of actually this particular, what we can draw out from here is that, I mean, some of our patients certainly, I think they may still want to do radiation. Okay, the point that I'm trying to get out from here is that actually, if a particular patient want to perform radiotherapy, okay, I would discuss with the patients and then actually start to actually to inform the patient that such a study does exist and the effectiveness can be actually enhanced through the use of hyperthemia. In other words, I want the patient to go back and discuss with his oncologist to reduce the dosage of the radiotherapy dose used. For example, over here I mentioned that a typical radiotherapy dose in treating prostate cancer is in the region of 70 to 80 GY over here. So if the patient want to use this method and to enhance the radiotherapy, he should discuss with the radiotherapist and then reduce this dosage certainly. And what dosage to be used depends on the confidence level of the radiologist in this case here. Yeah. So I mean, yes, 4 GY will still be higher effectiveness as compared to the GY, but the 2 GY itself is already okay. And particularly for those patients who experience a lot of side effects from the radiotherapy, or if the patient is very weak or very old, I would actually suggest to use a lower dose as compared to the higher dose, because the effectiveness has already been shown to be good. Yeah, hope that answer your question as well.
1 minute. 1 minute, I will ask. Okay. טוב, פלור, לגבי השאלה שלך, אין לי מה לשאול אותו, אני יודעת מה הוא יענה. Okay, we can continue, and about 12:10 we will go to lunch break, okay?
All right, so about an hour from now, huh? Okay.
Yeah.
Okay, so I try to finish this section as soon as possible. Okay, so we have take a look at the radiosensitizer of hyperthemia in radiotherapy. Next, we look at chemotherapy. We understand a little bit more about chemotherapy. What are the limitations? And I think many of our patients are, are subjected to chemotherapy when they first, approach the hospitals when they get cancer. And here the obstacles are, a major obstacle to successful chemotherapy is the development of cellular resistance to multiple structurally unrelated anti-cancer drugs. Very common we hear, okay, so-and-so go for chemo, but after a few sessions, the doctor say, oh, you are actually, this particular drug is not suitable for you, and you switch another drug already. In other words, it has become a particular drug's resistance, and this is commonly known as multi-drug resistance, okay, which occur very commonly in many cancer patients. Okay, so that is the problem. Okay, they keep changing the drug because as the body becomes resistant to it. So MDR is actually mainly due to the overexpression of the ABC transporter. ABC transporter means is an ATP abiding cassette transporter. In other words, a transporting system in the body, okay, of the drugs to the area of treatment. So a drug, therefore, that make the tumor cell more sensitive to the effect of chemotherapy is what we call a chemosensitizer. In other words, you make the body to be sensitive to this particular drug rather than resistance. Okay, so that is so therefore the hospital, the doctors, the researchers are looking for what things can make the tumor cell more sensitive to the chemotherapy drugs. Okay, so they are researching a lot of this, what we call synthetic chemosensitizer. Okay, for the last 10 years or so, there have been plenty of research on this synthetic. Just like, you know, the chemo drug, they want to manufacture all this in the lab so that they can actually, patent them and, of course, sell them at high price. Unfortunately, they are unable to do so until now. Okay, and I doubt. So therefore, the current research on chemosensitizer actually is on the use of phytochemicals, on natural products such as flavonoids, alkaloids, and polyphenol. Okay, for example, on the extract from the grape skin and grape seed extract, the famous polyphenol. So apart from chemosensitizer, this kind of phytochemicals, they are also less toxic. And of course, many of them, like the grape seed extract, they are also anti-tumor in nature as well. So currently, a lot of the research in terms of chemosensitizer are in this area, using different kind of phytochemical. Curcumin, for example, is another one. Okay, and many plants actually has been used in this area of research. So, but hyperthermia is also being studied as a chemosensitizer. Okay, in other words, use heat alone. No need to take any of those substances. Use heat alone to make the cancer cells are more sensitive to the chemotherapy drugs. And again, how does it able to do it? Again, if we understand it from the angle of the heat therapy, it is not difficult to understand. Because again, tumor cells, they are hypoxic in nature, very poor blood circulation, okay, in the area of the tumor. And the chemotherapy drugs are typically injected into the bloodstream, into the veins, so that it is being brought to the chemotherapy site. But if there are very little blood circulation to the tumor site, then very little of the chemotherapy drug will reach the tumor cells. But more of it will reach the good cells, because good cells, they are not hypoxic. They have good blood circulation. So again, just like the case of radiotherapy, it is a dilemma. Increase the dosage of the chemotherapy means more toxic to the good cells. Try to improve the more delivery of the chemotherapy drugs to the tumor cell, meaning that you will have more damage to the body. So very often you can see that the patient undergoing chemotherapy died. They died not because of the tumor itself, not because of the cancer itself. They died because of the damage to the various body function. Some could die because the immunity has been very, very low. Then they become infected with just a virus, and that a simple virus like flu killed them. They did not die of the tumor. Yeah, so that is because of the low blood circulation to the site. So chemo, in this case, hyperthemia, improve the blood circulation and therefore bring more, make the chemo drugs are more effective. That's how the principle of of this hyperthemia works. Now we look at this a few studies as well. Here it says hyperthemia enhances the efficacy of chemotherapy drug in heat-sensitive cells through interfering with the DNA damage repair. Okay, DNA damage repair of the cancer cells, of course. So this is one form of chemotherapy being used in the research world. It's called hyperthermic intraperitoneal chemotherapy. Short form is HIPEC, HIPEC. Okay, it's as a form of regressive chemotherapy has become quite popular. If you research in HIPEC into the PubMed database, you can find quite a bit of information on this. Now, previous research has demonstrated that actually 42 to 43C combined with this particular drug, or this is a chemo drug, is more cytotoxic to the human ovarian adenocarcinoma cell line, this particular line, just like the DU145 we saw in the prostate cancer case. This is another kind of cancer cell. In this case, is the ovarian cancer cell. This particular research shown that hyperthemia plus this chemotherapy drug is more damaging to the ovarian adenocarcinoma cells, okay, compared to the chemo drug itself. However, they also found that this method is not very effective for certain kind. In other words, it is not effective for all kind of cancer cell, ovarian cancers. Okay, there are certain types of ovarian cancer cell, they are resistant to HIPEC. Okay, so the tumor cell develop different mechanism to protect themselves from the extreme temperature, okay, which is often referred to as thermotolerance. Okay, so in other words, hyperthemia is not 100% effective, okay, for this ovarian cancer. So what the researchers over the years has found out is actually certain types of ovarian cancer cell are resistant to hyperthemia. Certain types are sensitive to hyperthemia. Okay, and they have isolated. And that's why for those researchers who have actually made use of these previous researchers, they will check whether a particular patient is having this type of cells or the other group of the cells. Okay, so the mechanism behind The hyperthemia combined with this chemo drug was more effective in suppressing the glutamate, these enzymic activities and expression. And also they disturb the mitochondrial function. And therefore, from there, it actually limit the survival of the cancer cell. So basically, what this sentence is trying to explain is that is hyperthemia plus this chemo drug actually, suppress this particular enzymic activity and expression, and also suppresses the mitochondrial function of the, and therefore limit with that done, it actually reduce the survival of the cancer cells. Trying to explain the mechanism it works. So heat enhances the uptake of the drugs by the cancer cell, leading to an increased intracellular drug concentration. Okay, as I explained earlier on, heat bring about increased blood circulation, and therefore increases the uptake of the drugs. Heat also can increase the binding of the drugs to the DNA specific sites, and thereby aggravate the DNA damage and inhibit the DNA repair. The cancer cells, after they are being attacked, they are also trying to repair themselves. But in this case here, heat here has actually slowed down or inhibit their DNA repair. Okay. And in this particular case here, they enhance the cytotoxic activity of the chemo drugs. Okay, so that is based on the researchers, how the heat, how hyperthemia helps chemotherapy. So the research was actually done on this particular line of ovarian cancer cell, okay, A780. Okay, the research aimed to actually show the changes in the differential proteins of ovarian cancer cells. In other words, after the heat therapy as well as a chemotherapy, I try to identify the different proteins present in the body as a result of this form of treatment, and then compare them with those without the heat. So the key molecules that enhance the sensitivity of heat-resistant cell to the hyperthemia were identified. They found, okay, they found which are the molecules that can enhance the heat resistance of the cells of hyperthemia. They use the mass spectrometry to actually do quantitative analysis on the effectiveness. In other words, this method here, this is a chemistry method to analyze the effective, basically to measure the concentration, the type as well as the concentration of the molecules that were given out during after this treatment. 4 groups were formed again. Control group, okay, the group with the chemotherapy drug administered, and then the hyperthemia without chemotherapy drugs, and then hyperthemia with the chemotherapy drug. And the results, the group actually, the researcher identified 144 upregulated protein. In other words, they found that more proteins of, so it's actually a lot of changes in the body after they undergo this. Some upregulated mean produce more, some downgraded, in other words, they produce less now. Okay, some a lot more, 145 upregulated and 204 downgraded. So among the top 20 protein with significantly different expression level, nearly 2/3 were involved. Okay, in other words, for those upregulated protein, they found that 20 of them actually were involved in nearly 2/3 of the 20, the top 20. In other words, they categorize the protein they found into the concentration differential, the levels. And they find the top 20, a significant of them is involved in the DNA damage repair. Okay, and again, they subsequently verified this through another method. So consistent with the data, the expression of the RB, this is one particular type of protein, was significantly upregulated in cells treated with thermal chemotherapy compared to the cell treated with the chemotherapy alone. Basically, what it meant is that in this particular case here, this group of cells here, more given out in the thermal chemotherapy group compared to the chemotherapy group. And the conclusion is that in the heat-sensitive ovarian cancer cells, okay, earlier on we mentioned there are two types of cells. Not all are actually heat-sensitive, but in the particular group of heat-sensitive, the damage repair of the tumor cell DNA is actually improved or increased by hyperthermia, making it unable to fully repair when damaged by the chemotherapeutic drugs here. Okay, making the repair, the cancer cell try to repair itself, but making it, heat has made it more difficult or impossible at all. So as a result of that, hyperthermia enhances the efficacy of chemotherapy drugs. So RBL1, this protein here is a tumor suppressor gene, may be associated with the DNA repair, and therefore it may be a key target for hyperthermia to enhance the sensitivity of the thermosensitive cell to the chemotherapy drugs. Yeah, so basically this is the this research here talking about using hyperthermia to enhance chemotherapy drug, and in this case here they monitored the different types of proteins released after this treatment combination, and they found that this particular method is effective in terms of slowing down or actually inactivate the repair process by the cancer cells. So what it says is the hyperthermia increases the sensitivity of the tumor cell to the chemotherapeutic, okay, through interfering with the DNA repair process through this treatment, and in this particular protein here. This is a mechanism by which, according to the researcher. So what we can actually take away from here is that actually, ovarian cancers, not all types are suitable for heat treatment, are effective for treatment according to the research. And for those which are suitable, the mechanism is actually the heat itself causing the DNA repair of the tumor cells more difficult or impossible. Okay, so it is effective in that manner. Again, we look at another paper here, and this time is advanced ovarian cancer again, because it is quite a tough cancer to treat. Advanced ovarian cancer in a multi-center, a bigger study now, using these particular two drugs to undergo cytoreductive surgery. So cytoreductive surgery is a common treatment for ovarian cancer. Okay, so in other words, the goal is to remove the tumor and a nearby tissue. So do the surgery, and then after that do the chemo. This is the combination. Okay, so basically this is what they do: administer hyperthermic HIPEC again with these particular drugs, and then the other group is without HIPEC with the chemotherapy drug. And then the HIPEC was executed after the completion of the surgery. Okay, the surgery itself. And the temperature was controlled to be 40 degrees Celsius for 2 hours. Okay, in this case here, they use heated salt water Okay, and in this particular case, it's circulating. In other words, is circulating saline salt water at 40 degrees is being used to heat up the tumor region for up to 2 hours. Okay, 3 additional cycles of the chemo drugs were actually used. And during the follow-up, physical examinations and measurement of the serum cancer antigen CA125 level were repeated, were monitored 6 months for 2 years, and then every 6 months until year 5 after the completion of the whole treatment process. The tomography was actually performed at 1 month, 6 months, 12 months, 24 months after the last cycle of chemotherapy. Okay, and patient also completed the health-related quality of life questionnaire. This is how the study was done. The primary endpoint was a recurrence-free survival. In other words, was the cancer-free survival time. Overall survival and the side effect profile were also key secondary endpoints of the study. In other words, the study ended, okay, using these indicators here. Now let's do a quick discussion and then look at the conclusion. What can we learn from here? Hyperthemia increases the penetration of chemotherapy drugs at the peritoneal surface. It increases the sensitivity of the cancer to the drugs by impairing the DNA repair. From the last, we already seen that already. Hyperthemia also induces apoptosis and activates heat shock proteins that serve as receptors for natural killer cells. Okay, the natural killer cells are very important cells in terms of our immunity. It inhibits the angiogenesis and has a direct cytotoxic effect by promoting the denaturalization of the protein itself. So that is how hyperthemia works. Induces apoptosis. The results of the study are actually summarized here in this chart here. We look at with the hyperthemia treatment and with the hyperthemia treatment. Number of patients studied under this study was about the same, 123, 122. Number of deaths after this period, or up to 5 years, is 111 for the without HIPEC one. With the HIPEC one was 99. Percentage of death, 89, 81. Recurrence-free survival, okay, 10.7 months for the HIPEC group and 14.2 months for the without HIPEC group with 10.7. With the hyperthemia, it has increased to about 14.2 months. Death after 4.7 years. In other words, at 4.7 years after they started experiment, they make a tally on the number of deaths. With the hyperthemia, it was 50%, but without the hyperthemia group, it was 62% higher. The median survivor, in other words, the average, the median, the midpoint, okay, arrange them according to the lifespan. You find that the median survivor is actually 33.9 for the HIPEC group, for the without HIPEC group, and for the hyperthemia group, it is longer by more than a year. Okay, so that is how the method with the hyperthemia treatment actually enhances the lifespan, I would say from here, enhances the lifespan of the of this group of ovarian cancer patients. Okay. So among patients with stage 3 ovarian cancer, the addition of hyperthermic intraperitoneal chemotherapy to the cytoreductive surgery resulted in a longer recurrent-free survival, longer overall survival, and did not result in higher rate of side effect when compared to the surgery alone. Okay, so that was the another, I think, chemotherapy enhanced by hyperthemia study that we can actually see some highlights from there. This is another short one before I go to I end this section here. Hyperthemia. This is looking.
Ma'am?
Yes. Yes.
There was a question before. I don't know if you are doing the difference between chemotherapy and biological and immunotherapy. Like if you can do the difference between them and how to combine it with the hyperthermia and the three of chemotherapy and biological and immunotherapy.
I think, unfortunately, there isn't any, comparative studies of that nature around. I think that will be, I think, very interesting, but will be a very huge project for the researchers to undergo. In fact, I think even for immunology, okay, treatment of cancer patient, currently, I'm not too sure whether there are studies using hyperthemia to actually to enhance the effect of the immunology therapy, because immunotherapy currently used in the hospitals are those that are synthetic. Most of the immunotherapy studies are actually using synthetic so-called drugs to increase the immunity of the cancer patients. Hardly anyone actually in the mainstream study use natural immunotherapy agents, okay, to do the study. I mean, later on, after this course, let me go and actually see if there are any studies of that nature. If there are, I will actually try to do a summary, and yeah, I can actually send to you so that you can circulate to the participants today. All right, because we did not do that. We did not discuss that. That's why I never actually make a comparative study on that. All right.
All right, thank you.
Yeah, so here the using hyperthemia to enhance the uptake of these particular drugs again, and the rate of conversion to the reactive metabolites. Okay, so again, basically, they are basically using different indicators, different ways of measuring the effectiveness. Okay, so here is using the experiment is on advanced rectal cancer here, and the methods again. We just quickly look at the method. I want to finish this part already. They put the advanced rectal cancer patients into different groups. Group A with a lower dosage of radiotherapy, 139.6. Okay, one group with hyperthemia, one group with that hyperthemia. The one with another group now with a higher dosage of radiotherapy, radiochemotherapy. Yeah? Okay, so in this case, is actually radiotherapy plus chemotherapy plus hyperthemia. So it's three things together now. Okay. Okay, previously we were just looking at radiotherapy plus hyperthemia or chemotherapy plus hyperthemia, but now is radiochemotherapy plus hyperthemia. Okay, the variation is in the radiotherapy. Okay, the two groups here, A and B, are in the variation is in the radiotherapy dosage. Again, 2 or 3 cycles of chemotherapy were administered, and again, hyperthemia administered is actually immediately after the radiotherapy, temperature 39 to 40, the mild, very mild hyperthemia. The results in the hyperthemia subgroup of group A, meaning a lower dosage of radiotherapy. Okay, more patients achieve downstaging. Okay, because downstaging meaning that from higher stage drop to a lower stage now. In other words, healing is better when compared to the non-hyperthemia group. Okay, so from 57.9 drop to 38%. Okay, compared to 38%. So for the other group, the number of patients with significantly less, okay, the number of patients with this indicator here, significantly less in the hyperthemia group as compared to the other one without hyperthemia. So also in group A, hyperthemia appear to reduce the distant metastasis and increase the disease survival time and improve the overall survival. Okay, so in other words, somehow in group A, but why group B there wasn't actually the similar observation, I'm not sure. Okay, but at least in the lower dosage group, okay, hyperthemia seems to actually reduce distant metastasis, in other words, spread to a further location. Okay, increase the survival, the disease survival time. Okay, and also improve the overall survival, longer period of survival. Remember, these are advanced rectal cancer patients where the survival, the 5-year survival rate is very low. So the conclusion that actually have been made is actually hyperthemia seem to increase the response of both primary tumor and the lymph nodes, okay, to pre-operative radiochemical therapy in patients with locally advanced rectal cancer. And again, patients with downstaging show better survival. In other words, the stage drop, okay, after they perform this combination of treatment. Okay, again, of course, this is although it's a big group, but then I think the conclusion is that they need to have confirmation. This is a normal protocol by the researchers in the mainstream medical world. It's always like that. Okay, they do not want just based on one center. They want it to be repeatable, evidence-based, as they called it. Yeah, so I think those are the research I want you to be aware of. But also I noticed that in recent years, there are also other kind of hyperthemia. You may be you may come across one of the terminology they use is called thermal ablation. So I look it up on the internet. What is thermal ablation? It says remove tissue or part of the body or to destroy its function. For example, to remove the inner lining of the uterus. A catheter is inserted through the cervix into the uterus, and a balloon at the end of the catheter is inflated, and the fluid inside the balloon is heated to destroy the lining of the uterus. So in other words, something is inserted into the tumor itself and then cause the tumor to be heated up. Now, previously, all the hyperthemia method, we are talking about indirect method. In other words, use heat to be applied on the surface. The heat penetrate through the tissues and then destroy the tumor. But more recent years, this is another group of research being done. Okay, something is inserted directly into the tumor and then cause the tumor to be heated. Okay, so basically, look at this particular diagram here to understand a little bit more about magnetic hyperthermia now. Okay, this is one type of thermal ablation. Let's say there is a tumor in the brain here. Okay, what they have done is actually through the use of magnetic nanoparticles. The particles is in the liquid form. So they injected the magnetic nanoparticles directly into the tumor site. They identify it through the location through MRI, and they injected this magnetic nanosubstance into the tumor directly. And then they use an external magnetic force, magnetic field now, because the substance injected into the tumor is magnetic in nature. Of course, what is magnetic? Of course, it's iron. Okay, very often it is iron. Of course. Okay, so high dosage. Okay, iron is just one of the many types. Okay, a typical one is iron, where they can actually cause the temperature of the tumor now to increase. Okay, so it is magnetic imaging is guided by hyperthermia, thermal. It also can bring about thermal cancer therapy and chemotherapy release. Okay, so this is one method of magnetic hyperthermia or thermal ablation that has been actually been used recent years. So in case you come across this research, you can actually you are interested, you can look into the details over here, okay, from the database. Okay, so this is just to indicate another one here, magnetic hyperthermia. They inject it into the chest area, and then from there the blood circulation bring it into the tumor, or you can directly into the tumor depending on the situation. And then basically, they want to get this, magnetic substance into the tumor itself. Okay, and then use a strong magnetic force to actually interact with the tumor. Okay, so this is a very new method of actually achieving the hyperthermic results. And typically, this method here, the temperature is higher, especially the previous one here, the temperature is higher. Okay, but then the precision of the injection is very important. Okay, because the temperature can be higher to around 45 or even degrees higher. Okay, and this is actually some of the mechanism of how the whole thing works over there. Okay, no, just to show you, I mean, this is just the diagram extracted from one of the paper there. They also come out with, you can see that local heating of the tumor cells can be as high as 47 degrees, which in our traditional hyperthermia, we never go above 43 degrees Celsius in most of the studies. But here they go up to 45 and above. Okay, this is one research that actually, one group of research that happened to appear in the hyperthermia research. And for those of you who are interested in the hyperthermia research, I think there is an upcoming hyperthermia conference to be held in Europe again this year, I think. You can always join them as a participant. Okay, and you can become a member of the hyperthermia association in Europe. Yeah. Yeah, so I think with that, I think I just end this section on the hyperthermia research. Hopefully that this section will give you an understanding on hyperthermia. And subsequently later on, I think in your use of Ontsu device, how you can make use of your knowledge of hyperthermia, okay, to help your patients. Should they decide to, to use Ontsu, how you can actually help them to use Ontsu if they insist of going for radiotherapy or chemotherapy or combination of both. All right, so that is the first part of my sharing. Okay, now I think still have time for another 20 minutes. I want to quickly go into the Moxie Bashan part. Let me just close this.
I just would like to say one word, okay? Man?
Yes.
I would like to say one word in Hebrew, okay?
To do what?
I just would like to say one word in Hebrew to the students, okay?
Okay.
בעצם הוא סיים פרק מסוים בהרצאה שמדבר על מחקרים היפרתרמיים. בעצם עכשיו הוא עובר למוקסה, למחקרים ולעבודות על מוקסה, שזה בעצם היפרתרמיה העתיקה. אני אומרת לכל מי שלא מדבר בשפה הסינית והיפנית. אז אנחנו ממשיכים בעצם לחקור היפרתרמיה, אבל היפרתרמיה עתיקה. ובעצם הם הולך להראות לנו שזה לא המציאו היום, והעבודות היפניות על חום וסרטן הן הרבה יותר עתיקות. היפנים העתיקים פחות מתעסקים במחקרים, אז ברור שאנחנו נמצא פחות מחקרים עתיקים, אבל יש המון עבודות והמון הוכחות על היפרתרמיה. אז בעצם אם נסכם את הפרק הראשון, הוא הראה לנו שהיפרתרמיה בשילוב עם הקרנות ועם כימותרפיה ועם הקרנות וכימותרפיה ביחד משפר מאוד את היכולת של המטופלים להחלים. הוא לא דיבר בכלל על תופעות לוואי, הוא לא דיבר על דברים נוספים. נראה לאן הוא ממשיך את ההרצאה, אבל בהחלט אפשר גם לשאול אותו האם זה מקטין תופעות לוואי, האם זה משפר איכות חיים, אבל כרגע הוא דיבר על בעצם הישרדות והחלמה, בסדר? ועובר עכשיו למוקסה, שמוקסה זה היפרתרמיה עתיקה. בסדר? אנחנו עדיין נשארים בהיפרתרמיה, זה מה שהיה חשוב לי להגיד, שזה לא נושא חדש או מוקסה, אלא פשוט היפרתרמיה עתיקה. Menga, you can continue.
Okay.
Thank you.
Okay, so in this section, I want to, as I mentioned, I want to actually bring you the Moxie Bashan. And of course, acupuncture. Moxie Bashan is always discussed together with acupuncture, okay, which I think all of you are familiar with. So let me just briefly go through Moxie Bashan, okay, make sure that we have the same understanding. So Moxie Bashan is a form of therapy that entails the burning of these mugwort wood leaves, okay. And what is this? It is actually a form of Chinese medicine practice. And the purpose is always to strengthen the blood, to stimulate the flow of qi or energy and maintain good health. So that is what Moxie Bashan is all about. Okay, and these plants, I believe it is also grown in Israel. Is it grown over there? Over here in Singapore, Malaysia, we can grow this plant also quite well. Okay, sometimes it's just, grown in the wild. Okay, of course, people actually, have been growing this in big quantity in China. And of course, they dry the leaves and this is how it looks like, moxa. Okay, and they make into the different types of shapes for different purposes. Okay, and this is basically come from this plant here. And this is how they apply the moxa and Moxie Bashan in this case here. You can see that this is what we call direct Moxie Bashan. You put the moxa on the skin directly. and you light up the moksa. And in this particular case here, the heat, I mean, the therapists or the TCM practitioners believe that the moksa itself has a medicinal effect. Not only the heat went into the body, but the medicinal effects of this medicine also going into the body as well. But you can see from here that it produces smoke. Okay, so that is direct moxibustion. But more commonly, I think you see this form of what we call indirect moxibustion, where you put something on the skin, okay, before you put the moksa cone, the moksa cone on onto it here. And what is the advantage of the indirect, and what are the disadvantage of the direct moxibustion? In the case of direct moxibustion, very often it burns a scar into the skin, and modern days will not allow this kind of treatment. If you use this method to treat your patients and you got a scar here, I think the therapists will be sued in court. They will report to the ministry and the therapists will be having problem. Okay, so this is not in common practice, but it is used in maybe in remote places in China. Okay, I do not know of any hospitals in China using this direct method. Okay, but I do know that hospitals are using indirect moxibustion like this. Okay, typically they use salt. They put spread some salt, table salt over here, and then they put the cone, the moksa cone, and then start burning it. In this case here, you will not burn into the skin. Okay, they use garlic, they use ginger. Okay, so those are common type. And of course, so those are two methods of applying moxibustion. And the third method I want to share with you, this is what we call moksa sticks. They make use of sticks like this. Some long, some are long, some are short. They light up the moksa stick and actually bring it to a distance about 1 centimeter from the skin and actually burn into, get the heat into the skin. Okay, and of course, typically, and this is mainly for the shorter type. Okay, in other words, it's hands-free. They design holders like this that sit on the skin and they light up the moksa stick and you put into there. Okay, there are many different types. Okay, there are many different types. And some moxibustion are actually, attached, like this one here, attached to the acupuncture point. In other words, they put the needle and then attach the moksa stick, the burning moksa stick, to the acupuncture to enhance the effect of the moxibustion. Or this is also being referred as moxibustion as well. Of course, in this case here, acupuncture with moxibustion. Okay, so these are some of the common apparatus, okay, they design to facilitate the use of the moksa sticks. Okay, so different shapes for different parts of the body. For example, even for the knee, for the shoulder, okay, for abdomen, different parts. So these are the different holders. Okay, so that is really the use of moxibustion. And of course, for those who want to practice moxibustion with needles, they use special needles like this. Okay, that's how they use special needle for you with moxibustion. I'm not sure whether some of you practice this in your practice. Okay, special extender, okay, for use with moxi. And of course, okay, let me see. There's a video. Let me see where I can connect the video. Can you see the video?
No,
Are you able to see the video?
no.
No. Okay. How to make the video visible to you? Let me see. Sharing video? I think so.
You need to share. You need to share the screen, like the the YouTube screen,
Okay.
or I don't know, or
Okay,
just send me.
Okay, let me try the sharing first. Let me
now,
just
yes. We
can
can
you
see
see?
now. Yeah.
Okay, so that's just a show, a glimpse of different types of moxibustion in place. And let me get back to and of course, I think if you see carefully from the video, the disadvantage of this method of treatment is the film coming out from the burning moxa itself. Although there are some moxa which are actually claimed to be smokeless, but I have not seen the true smokeless moxa in action yet. Okay, so in many hospitals in China, they have actually stopped using moxibustion. Okay, unless they have a very strong suction system. Otherwise, imagine in the room there are so many people practicing the moxibustion, the amount of film actually given out in the room will be tremendous. Okay, so that is moxibustion. And let's look at some moxibustion research actually done, particularly moxibustion study in cancer treatment. In this particular study, this paper actually is on moxibustion on the adverse effects of tumor chemotherapy. Again, many of the studies is actually using moxibustion, okay, to overcome the side effects of chemotherapy. And in this particular research, is actually a large-scale, meta-analysis, is literature review, basically. The authors examine through the Chinese medical journal database all the way from 1992 to 2012, over a 20 years period, regarding the use of moxibustion on tumor chemotherapy effects. In other words, in this 20-year period, all the papers that satisfied their condition, these authors actually dig them out and actually do the analysis. They found 64 clinical studies were satisfied their conditions, and they examined these 64 clinical studies in terms of 3 areas. First, acupuncture point selection. So they want to see which are the acupuncture points most effective or most frequently used in the application of moxibustion to reduce chemotherapy side effects. They also examine method of moxibustion, whether it's direct, indirect, or is it on the moxa sticks. And of course, they also look at other clinical observations. So the results from this study was first the prescription acupuncture point selection characteristics. And out of the 64 studies, they actually found the following. And here, I have actually tried to include the WHO's symbol for you. In the original report, they only use the Chinese acupuncture point names. But I have actually given you the ST, the WHO symbols, so that I think most of you that study acupuncture points would be able to understand. Okay, so Chu San Li, which is ST, stomach 36, which is on your leg, is the most frequently used one with 49 out of the 64 studies, 49 of them, 76% of them make use of this particular point. Okay, ST36 stomach point, longevity point, very important. The second most frequently used point is GV14, which is on your spine, on the neck area here, okay, where it is a joint between the cervix to your thoracic spine, okay, that point. Where you bend your neck, there is a hump over there. That is GV14. Okay, that the second position, almost 20% of the studies make use of this point. The third frequently used point is CV8, which is your belly button. Okay, belly button. I think my data could have some number mistake here. This one could be 29, I think. Okay, I think there's an error here. I think this number should have been actually, I will check the paper again later and update this number. Okay, 14, 21%. Okay, Zhongwan is CV number 10, midpoint between your chest line and your belly button, the midpoint. This is a stomach point. Stomach point also frequently used. And then San Yin Jiao, spleen 6. Spleen 6 is actually 4 fingers above your leg, the highest part on your ankle. Okay, on your spleen meridian. 20% of them. And then the next few here is bladder meridian on the back of our spinal area. Okay, bladder 17, bladder 20, as well as actually bladder number 23 here, Shen Shu, which is actually kidney point. And then CV4, CV4 is 4 fingers below your belly button. Okay, which is another longevity point. And then PC6, which is actually on your wrist over here, 3 fingers, okay, below your horizontal wrist over here, is in the midpoint here, which is also very important for your pericardium health. And then large intestine, number 4, okay, which is between your thumb and your index finger, this particular point over here. This is your Herku, or large intestine point. So those are the 12 most frequently used points in overcoming chemo side effects. But why did the researchers 64 studies make use of these points so frequently? Okay, we discussed the importance of those points. The first reason is actually to regulate the spleen stomach, to strengthen the body and to cultivate vitality. In traditional Chinese medicine, the emphasis is always on the health of the spleen, stomach, meridians. Because if you want a way to recover from illness, if a sick patient wants to recover from a illness and become healthy again, the spleen, stomach, meridian combination cannot be unhealthy. This is where our digestive and absorption power is. If we translate that meridian into our modern day understanding of our body parts, that is actually the digestive and the absorption power of the body. Okay, so this is what the spleen and TCM says. The spleen and the stomach are the foundation of the acquired constitution, and it is a source of qi and blood biochemistry. Very important. And of course, for these 2 points, for this function, ST36, CV10, and of course, SP6 are involved here. Okay, and of course, the bladder meridian behind as well. Okay, so the key to the onset of the cancer lies in the lack of qi, endogenous cancer toxins. And if these disease-causing agents stay in the body for a long time, the deficiency will become worse. Okay, so therefore, in this case here, they combine with the frequent use of chemotherapy drug. The drug poison damages the spleen and the stomach even more, causing imbalance of the qi movement. Water and grain transportation become abnormal, and insufficient resources to produce a qi and blood, and therefore unable to regenerate the essence and fuel the marrow. Okay, and therefore very often we see that the clinical immunosuppression, the immunity is very low, lack of blood cells, white cells as well as red cells as well, and many other reactions also take place. So therefore, the reason, number one reason for them to choose the concoction of the combination of the acupoint as discussed earlier is to regulate the spleen stomach function so that the body can be strengthened and vitality is cultivated. Okay, so it is very important to regulate the spleen and the stomach functions. Clinical in the clinical acupoint selection, it is important to do that because we want to nourish the qi and we want to nourish the blood, and of course to support the righteous qi so that it can actually in this aspect here, as I mentioned earlier on, ST36, SP6 are the most frequently used one. Okay, and those are the supporting evidence. Okay, the use of ST36 and SP6 here. Okay, I'm not going to discuss the details. Just want to mention that in TCM, the concept of congenital and acquired constitution is important. And these two here, this belong to the stomach meridian and this belong to the spleen. The combination of these two meridians here actually is responsible for what we call the acquired constitution. Congenital constitution come from our mother, okay, the inherited, or the Western world called genetic. Okay, a person can be very weak in terms of genetics, but we can always make up for the lack in the genetic through the use of the acquired constitution. And how do we perform it? Through stomach meridian, through stomach function, and through the spleen functions. Likewise, for a cancer patient, if we want to recover from the cancer itself, it is the most important for us to work on the stomach, to repair the stomach, to repair the spleen, so that digestion as well as absorption can be good again, can become normal again. So you can see from there that these two were very important, actually were frequently used in the selection by the researchers in terms of trying to repair the body, try to alleviate the symptom, the side effects of the chemotherapy. We then look at the next group of acupoints, CV. CV is in the midline. Okay, this is the conception vessel in the midline. Okay, CV8, as I mentioned, this is the belly button, and CV4, this is 4 fingers below the belly button. Okay, and actually the name CV8 called Shen Que here is the root of life, the name. Okay, and it is the connected with true energy. And therefore people who practice Qigong, okay, always try to get the energy into this particular section here from CV8 all the way to CV4. Some people say it is CV6, but some people say it is CV4. But nevertheless, the energy, the Qi, can be concentrated, and a lot of people, a lot of Qigong practitioners try to enhance the energy to be along this particular section here. Okay, and of course that is actually the opposite of the direct opposite of CV8 is GV4. Okay, that is actually in other words, if you poke a needle from CV4 through the body, you will reach GV4. And some Chinese practitioners believe that you can connect the energy of CV8 to GV4. Okay, if you can successfully do that, they believe that you will be able to achieve eternity. Okay, but that is I mean, some aspect of it in terms of importance of this meridian point. Okay, so the power of these two acupoints is to consolidate the foundation and cultivate vitality, strengthen the body, strengthen the immunity. Okay, strengthen the immunity, strengthen the body's immunity. Typo error again. And then after, and when we look at another point, GV14, which is on the back, on the neck here, joining the cervix to the thorax. This is a GV14. Okay, it is a yang replenishing point. Okay, it belongs to the governor vessel, intersection of the 3 yang meridians on the hand and the feet. Okay, yang meridian. Basically, according to Chinese medicine, the back is yang in nature. The front is yin in nature. Okay, so the yang nature, if you want to input yang energy, the back is actually a good place to input yang energy. And as I will show you, all cancer patients are yang energy or yang qi deficient. Okay, and Da Chui GV14 is an important place for us to provide the yang energy into the body. And of course, our Onetsu device is a yang energy generator. Okay, it produces yang energy, and a good place to input this energy into the body is Da Chui, which is GV14. Of course, there is another funnel location. I will review that to you later on. Okay, so it invigorates the yang energy of the governor channel and regulates the meridians. Okay, it's very important. It has the function of promoting yang and replenishing the qi. Okay, promoting the metaplasia of qi and blood and nourishing the bones as well. Okay. Modern research also show that this point can inhibit the tumors and improve the body's immunity. So it is commonly used in the treatment of cancer. 大椎. Okay, this point here, GV14, common use in the treatment of cancer. Okay, it ranks second only to Chu San Li, to ST36. Very important point. Okay, so that is where Da Chui is. The percentage I mentioned, not percentage is wrong. And then we look at another group of points, I think, where all the Onetsu practitioners are very familiar. These are on the back. These are called the back shoe points. The back shoe point. Yes. Yes.
Can we do the lunch break and continue?
Okay. Okay. We stop here. After I come back, I will discuss this back shoe point because it's an important section. Okay.